Okay, 57 million people in the United States have prediabetes, and most don't even know it.
Yeah, Nisha and Troy are talking with an expert about symptoms and warning signs. Good morning.
Glenn, it's actually a quarter of those people that you just mentioned have no idea that they are living with diabetes. Experts know they have it, and we have an expert joining us today. This is Dr. Andrew Petersen from the Holtorf Medical Group. Welcome back.
Thank you.
That many people have no idea.
Yeah, it's crazy.
Why is that?
Maybe they're not going to get care, they're not getting screened, they don't pay attention to their bodies. The care they receive is too fast.
Maybe I should ask you this question. What are the symptoms that people aren't noticing for diabetes?
They're drinking lots more water, they're eating more. If it's type 1 diabetes, they're losing weight. If it's type 2 diabetes, they're gaining weight. If they've gained weight, and this is the one that's obvious to the patient, but we overlook it as physicians, if they start to get dusky around their neck or get skin tags under their arms or their neck, they already have diabetes.
What does dusky mean? What is that?
A darker color, like their skin seems a little darker around their neck and their skin folds under their breast. If the skin is darker there, they probably already have diabetes. They don't have pre-diabetes anymore.
What are some of the health risks going on in life if you don't get diagnosed with diabetes?
Right. Diabetes is too much sugar in your blood, and the sugar bonds or binds to the outside of the artery. So anything that needs blood will be damaged. Well, everything needs blood, right? The smaller the vessel, the more damage. So the kidney damage, and you go on dialysis, blindness because the arteries in the back of the eye are very small, heart attacks, strokes, numbness and tingling in your feet and your fingers, poor circulation that would cause poor healing, infections.
The list goes on.
Well, you lose your feet, you lose your kidneys, you lose your eyes, and you have a heart attack.
Who's more likely to get diabetes? Men, women?
Race?
Men and women, it's the same. African Americans, Hispanics, and Native Americans have it more. But it is so common in the United States that Caucasians have it all the time. Asians have it the least, but they still have it. So it's not like you should sit back and say, oh, I'm good because I'm not a Native American.
Risk group.
Right. We're all in the risk group.
What is the test that you can have to see if you are diabetic?
Right. To officially have diabetes, you get a blood sugar, a random blood sugar or a hemoglobin A1C. But long before that, you can know if you have prediabetes, and once you're headed down that road, nothing will change the trajectory unless you change your diet and probably end up taking a medication.
Again, just give me the 3 things that will, so our viewers at home can just go, that's me, I need to call you now. 3 top things that as a sign of diabetes.
Okay, are you overweight?
Yep. Drinking
do
water.
Do you not exercise at least twice a week? And do you find that you are drinking more or eating more?
Okay.
So those also play into prevention. I mean, how do we never get to this spot?
Sure.
Right?
We're in a tough spot because most of our foods are processed foods. And insulin goes up when we eat simple carbohydrates. We used to not eat a lot of simple carbohydrates because they didn't exist. You couldn't get white flour or purified sugar, right, about 200 years ago. Well, anytime we eat those foods, our insulin goes up. The more our insulin goes up, we're now taking one step forward towards diabetes. So if we eat refined carbohydrates on a regular basis, and most people do every single day, then we're at risk for diabetes. If we eat mostly vegetables, whole grains, meats, legumes, fruits, then we're probably okay. But if we're eating any processed foods, whether it's pasta, white rice, white flour, white sugar, you're at risk.
Moderation. Wow. Moderation. Holtorf Medical Group is in Utah County. So great to talk to Dr. Petersen because he can direct you to the right testing and right information, what you need to do next. Go to our website for more info, abc4.com. Glenn and Emily, back to you.
Okay, thank you.
All right, thank you both very much. Coming up, newlyweds who will remember their ceremony forever.
Yes, they will, but probably not in the way that they hoped for.
I will stop the ceremony if you do not get out of the way.
Okay, we're going to show you why the priest threatens to stop the ceremony coming up next.